Opioids and prescription painkillers. We hear a lot about the current epidemic, but how did we get here? From sports injuries and accidents to cancer treatments and surgery recoveries, patients and their families have sought relief from severe pain, and doctors have felt compelled to help. In the 1990s, medical guidelines encouraged doctors to evaluate their patients' pain and prescribe treatments that kept patients on the happy side of the scale. Soon, pain became another vital sign, like blood pressure, pulse, temperature, and respiratory and breathing rate. Meanwhile, pharmaceutical companies developed misleading marketing campaigns that said prescription painkillers were safe and effective for pain treatment. Powerful and highly addictive painkillers like OxyContin, Percocet, and Vicodin started to become common household names, and communities around Minnesota started seeing their deadly effects. In fact, today, more than 4 in 10 people know someone addicted to opioid painkillers. Opioid-related emergency room visits, paramedic calls, and law enforcement dispatches are all on the rise. And to make matters worse, some people who became addicted to opioid painkillers developed more addictions. The sad truth is, research shows opioid painkillers are not more effective for long-term treatment of severe pain than safer alternatives. It's time to put a stop to this. Minnesota's hospitals are stepping up for our communities to ensure that every patient receives effective treatments for pain without risks of addiction. And we're implementing new prescribing guidelines that reduce the risk of overprescribing and decrease the amount of opioids prescribed in emergency rooms and clinics. But Minnesota's hospitals cannot heal the damage done by the opioid crisis alone. We think drug companies should be held accountable for their role in the crisis, starting with requiring them to help cover the cost of addiction prevention and treatment. Together, Minnesotans can build a healthier future. Minnesota's hospitals are stepping up for our communities and families. Join us at mnhealthycommunities.org.